fourth year Brandon University nurse educator. Social work actually reached out to me and just said that you had some concerns and were looking for some further education regarding cognitive decline that you're seeing in your father. Is that correct?
Yeah, I noticed a lot of like mental changes from my dad, and then maybe about a month ago he was diagnosed with dementia, and I've been really overwhelmed because I'm now like I'm the closest family member, so I'm taking over primary care, and I just feel like I don't know what I'm doing. So I really appreciate you being able to take the time to talk with me.
Of course. Yeah, hopefully we can kind of steer you in the right direction and we'll send you home with quite a few resources as well. I'm just going to share my screen, okay? So just bear with me for 1 second. All right, can you see the PowerPoint?
I can. Yep.
Okay, so PowerPoint is strategies for managing cognitive impairment in the aging adult, essentially what you're here for today. So we created this to help caregivers. So it's a caregiver-focused approach to promoting function, safety, and well-being for whoever you may be supporting. So learning objectives, we want to be able to describe the cognitive changes associated with normal aging and age-related cognitive disorders, recognize behaviors and early signs, apply practical strategies to support these folks, identify signs of caregiver stress and understand the impact that it can have not only on you, but on them as well, and then be able to locate access community resources for additional support. If at any point you have any questions, please jump in.
Sounds good.
Perfect. So why does this matter? So individuals are living longer and cognitive decline is the natural consequence of aging, one of many. 40% of individuals will experience some form of memory loss or cognitive decline over the age of 65, regardless if they have a formal diagnosis. This can be one of the most challenging roles an informal caregiver may encounter, which I'm sure you've started to feel that. So I'm glad you're here. Caregiving for those with cognitive decline as opposed to other issues report higher levels of unmet needs and available resources. Caregivers are at high risk for becoming the secondary patient, which we want to prevent as much as we can because we're seeing more and more of it. Experiencing cognitive decline can be very distressing, not only to you, but also to your loved ones. So we want to be able to support that as much as we can. So recognizing cognitive changes. So there's normal parts of aging, signs of cognitive decline that are normal, and signs of cognitive decline that require further investigations. We want to be able to differentiate this. So in terms of normal aging, you might be unable to remember details from conversations you had a year ago, remembering names of acquaintances, forgetting things occasionally, appointments, birthdays, occasionally having difficulty finding words. You might be taking a little longer to process things or think things through, and you might struggle with new technology. I think we all do. In terms of things that do require further investigation, so if your father is unable to recall details of recent events or conversations, unable to recognize or know the names of family members that they're close with, forgetting things and events more frequently, having frequent pauses and substitutions when finding words, difficulty completing familiar tasks, changes in language communication, impaired judgment, disorientation, changes in their mood, personality, or behaviors, or changes or challenges understanding visual and spatial information. These things can mean a variety of different things, though. So I want you to remember, and I just want to preface that these are not always indicative of dementia, but they do require further investigation.
So I know you made the comment that these signs mean a variety of like different things. What would be some other reasons that would cause these signs?
Yeah, good question. So individuals, especially older individuals, many of them are on a variety of different medications to manage different health conditions. The aging body does process and metabolize and absorb medications a lot differently than the younger body. So this can play a role. Changes in electrolytes and changes in blood work. So imbalances within the body can play a role. Sensory, so hearing, vision can play a role, and infections, things like that. UTIs are very common as well. So again, just things that do require further investigation and do require to be seen by a healthcare provider. Does that answer your question?
Yeah, it does.
Perfect. Okay, everyday care strategies. So we want to establish a routine. We want to use to-do lists, visual calendars, things like that. Plan and engage in activities that the individual enjoys. So if your father likes going for a walk or maybe going to coffee group at Tim Hortons, incorporate that. Promote independence and allow the individual to do as much as they can. Purchase loose fitted clothing. We do not need 12 buttons on a shirt. I see this all the time. Let's get easy clothing that the individual can use. Serve meals in a consistent, familiar place. Give the person enough time to eat. We don't want to rush them. We can use bubble packs, consider home care for medication administration as well, just to promote that safety aspect. Talk about the past, reminisce, look at old photo albums, things like that. Individuals like to, they do find it very settling to look at things from the past, as they often don't remember things that happened recently. Place any needed items where the person might be able to reach them and use them and access them. So if you want them to brush their teeth, make sure their toothbrush and their toothpaste is out on the counter. Encourage decision making and plan for the future. When you do start to see cognitive decline, it's important that we do start to make those decisions about future plans so that the individual can be part of them. Safety at home. So cognitive decline and cognitive changes can significantly impact an individual's safety and well-being. So cognitive decline and aging can cause, struggles with judgment and forgetting how to use things like appliances, things like that. They might lose track of time, place, even unfamiliar areas, or even familiar areas. So they might, they lose that, they're disorientated about where they are. They might show shifts in their behavior, including things like confusion, suspicion, frustration, things like that. They might have reduced physical abilities, right? So safety, keeping balance, coordination, things like that. And then they might experience sensory changes, which we already kind of talked about. So depth perception, hearing, vision, things like that. So to promote safety in the home, we want to keep dangerous things locked away and secured. So laundry detergents, medications, alcohol, any other, chemicals that you might have in the home. Eliminate tripping hazards. So loose cords, items, carpets that move, area rugs, things like that. Ensure adequate lighting. Lots of these guys get up in the middle of the night to go to the bathroom, or they might wander. We want to make sure that they are able to see. So providing night lights, things like that. Secure furniture and large items are secured to prevent accidents. So lots of them will use furniture to navigate and kind of move through an area. So we don't want that stuff moving. And then ensure equipment is available. So occupational therapy, I'm under the impression they will assist you with that in the hospital prior to discharging your father, and just make sure that you have the equipment that you need. So promoting a healthy brain. So we want to ensure that individuals' physical health is being managed, right? So we want to maintain a healthy blood pressure. Blood pressure and heart health have a significant impact on brain health. We want to incorporate a well-balanced diet. Canada's Food Guide is your best bet for that. How medications can affect the brains. We want to be able to understand that. We want to promote regular physical activity. We want to keep the mind engaged and active. We want to stay connected with social activities, and we want to be able to address both physical and mental health problems.
So do these things prevent dementia from getting worse then?
No. So unfortunately, dementia is a progressive disease. We're not going to be able to do anything that prevents it. However, we can slow the process down with medications and things like that, and we can promote brain health. So just as, you have a patient or a family member that has diabetes, you're going to promote, heart health. You're going to make sure that they're taking their insulin. You're going to make sure they're eating a well-balanced diet, low sugar, low carb, perhaps. They're engaging in physical activity. Just as we would promote health for that individual, we want to promote a healthy brain for these guys.
Okay, that makes sense.
Yeah. Okay. Perfect. So communication tips. So communication can be very challenging. I'm sure you've started to notice that. So we want to make sure we get the person's attention first. Don't talk to them if they're not paying attention. They probably won't answer. We want to speak clearly, slowly, use short, simple sentences. Allow processing time. Okay, so don't interrupt and ask a following question because they're still taking time to process the original question. Include the individual in conversations to support their sense of self and promote dignity. Use active listening, rephrase rather than repeat if they don't understand. Focus on one thing at a time. Use simple questions. Avoid elder speak, so avoid baby talk. If they're upset, listen and be present. Focus on what's in your control. Be patient. I know it can be hard, but be able to recognize your frustration. And if you do need to step away, that's okay. You need to also be able to take care of yourself. It can be frustrating.
Yeah,
So,
this was really helpful because I find myself constantly repeating instead of rephrasing, and then it causes me to be quite frustrated.
for sure. And I understand that. Yeah, it is. It's frustrating. Like there's no other way to put it. So we want to just provide some of the strategies that you can use. And yeah, it's never a bad thing that you need to step away. Like you shouldn't be feeling bad about that. Key principles. So for managing challenging behaviors, right? So just understand it's the disease. It's not the person driving the behavior, right? So that's something to keep in mind. Please don't take these things personally. Behavior is a way of communication, and these guys are unable to communicate the way that they once could. Um, adapt to the behavior rather than trying to control it. Look for triggers of unmet needs. That's a big one. Adjust your own tone, pace, and environment to reduce distress. What works today might not work tomorrow. It's going to be a constant, trial and error type thing, and that's okay. This is why we are providing you with the resources to seek support. We want to use, again, short, simple sentences, break tasks into smaller steps, check for medical causes, which we talked about, ensure safety, which we discussed, include the individual, which we discussed, and then use familiar photos or objects to connect. Caring relationships and dementia. So dementia can shift roles, right? So your once father, or your father, now you're taking care of him, right? Where once he was taking care of you. And that's very common, and that's a huge shift. So caring can bring a lot of emotional strain, and guilt, frustration, anxiety, and exhaustion are all common. So we want you to understand and know that self-care is not selfish, and it helps both you and the person you're supporting. We're going to provide you with many resources to help with that and help hopefully take away some of that caregiver stress. Because we want you to be able to focus on keeping that relationship with your father and strengthening that relationship. Okay. So, are you experiencing caregiver burnout? Um, so there's the 10 signs and 10 ways to reduce it. Again, this is going to be sent home with you. You can kind of read through and do a little self-assessment on your own, but the majority of us are caregivers. So I'm going to just move into accessing support here. So we want to be able to support you guys as much as we can through this challenging time. So Alzheimer's Society of Manitoba is fantastic. The hotline's right there. It's 24 hours. If you ever have a question that requires like anything, like any questions, they are there. They are amazing. They have a variety of support groups that I have listed there below. And then they have family education. So any part of the dementia process or cognitive decline process, any aspect of it, strategies, everything, like things to look for, things to do. It's all there. They have an in-depth calendar of all the different seminars and education sessions that they provide, and most of them are free of charge. So it is a great resource. So I encourage you to access that. I'm also going to send you home with this little cheat sheet. It's kind of a summary of everything we went over today. So we look at safety at home, everyday care strategies, communication tips, promoting a healthy brain, managing challenging behaviors, the support groups, and the Alzheimer's Society of Manitoba hotline is on there as well, and as well as the QR code for the calendar. And then here is just kind of a quick reminder, changes that need follow-up. So things that we talked about to follow up with, okay?
Yeah, this was amazing. I really appreciate all this information. This is definitely what I needed to hear.
Good, I'm glad. Okay, well, if you have any questions, feel free to reach out. I'm going to send you all of these resources, and I wish you guys all the best. I hope that things start to look up for you, okay?
Perfect. Thank you so much.
Of course. Okay, you take care.